welcome everybody. This is the panel on patient stories. I think I have some questions, slides. I want to just talk a little bit about one thing first. There are some notepads in front of you at your seat. We would like everyone to write a nice note to the doctors and medical staff at Mayo and slip it into the little can in the center of their table. And what we're trying to do is we're trying to pass along your words of thanks to them for all that they do. So when you get a chance sometime today, please go ahead and do that. Okay. We've got a lot of people here, and we could go, and one at a time. We're going to have to share some microphones and introduce ourselves really, really quickly. Go ahead.
Mike Lorenzen. I've had a MOG for about a year and a half now.
Carol Van Roy, and I'm the wife of Tim Van Roy, who has MOG for about 2.5 years.
I'm Sue Monlock. My husband Joe has had MOG for 9.5 years.
I'm Derek Stewart. My wife Jennifer has had MOGAD for 2 years now.
I'm Hannah Greer. I've had MOGAD for 26 years.
And my name is Jennifer Kalk, and my son Brody has had MOGAD for 5 years.
Thank you so much. I'm going to start first with Hannah. Hannah, you've had a story that didn't really start with MOGAD, and it took you a little while to get a diagnosis. Could you tell us a little bit about what that was like, and also how impactful it was to finally get the diagnosis that you landed on, which was apparently MOGAD?
Yeah, that's absolutely right, Julie. I first got sick when I was 6 years old in 1999 and did not receive my MOGAD diagnosis until 2024 at the age of 31. And I like to kind of characterize that whole time period, and especially in the last year, as sort of kind of a homecoming, coming back to myself and kind of feeling safe in my body for the first time in a very long time. And I'll talk a little bit more about exactly what that means in terms of the impact, but I'll give you a very brief story about how I came to have this correct diagnosis. So in 1999, I had my first ADM attack, an optic neuritis attack, and at that time, there was not a lot of conversation about a chronic diagnosis. It was very much, well, is this infectious? How do we get this under control? And I had a great doctor who gave me the magic steroids, and my vision returned, and I improved so much overall that I was sent home and had mostly a very happy, normal childhood for the next couple of years until 2003, when I had my first transverse myelitis attack. And at that point, the conversation around diagnosis shifted to something more chronic, and the first thing that was tossed around was MS. I was under the care of the pediatric neurology team at the University of Kentucky at this time, and they recommended that my family and I take a trip up to Stony Brook, New York, to the Laurie Center for Pediatric MS. And I spent a week with their wonderful comprehensive team. But at the end of that week, I remember them talking to me directly and telling me that they did not know what I had, but they knew that it was not MS. They were very confident in that. And I remember asking them directly, like, how do you know? And similar to what we heard Dr. Casiaguera speak about, is that none of the children that they cared for had ever had a normal MRI since their diagnosis, and it was very peculiar to them that I had had so many normal images.
Hi, Kim.
But I remember really taking that conversation in and thinking, okay, so this is going to be hidden, and the doctors aren't going to be able to see it.
Excellent.
So I've got to really take on that role and make sure that whatever's going on, I've got to catch it really quickly, because the doctors won't be able to see it until it's too late. And that really kind of characterized the lens through which I saw my health for the next 20 or so years.
I
had a lot of anxiety, a lot of depression, especially around my health. I was freaking out every time anything would happen, particularly with my eyes. And the next kind of milestone for me was shifting to adult medicine. It was a really scary time for me because it meant I had not seen
How's this?
any doctors that
How's
had
that?
seen
Can
me
you hear me
during
a
an
little bit better,
attack.
Kim? Okay, great.
And
Cool.
even though I respected those doctors very much, I sort of felt like they never really
just
got
let you
it.
know that we are
And
running
at
behind
the age of
this morning.
30, my neurologist said, Hannah, I don't think I need to see you anymore.
Great.
Your images are all normal. Most of your labs are normal. Your bladder's being managed by a urology team.
Yep.
And so,
We're
we're gonna cut you loose, basically. And I understood where he was coming from, but I remember after that appointment kind of sitting in my car and just crying and feeling so uneasy about that. I wanted a neurologist kind of in my corner. And so magically, a week later, I saw my primary care doctor, who was very compassionate and said, I'll get you a referral to another neurologist. And a few months later, I was able to see the neurologist that I now see also at the University of Kentucky. And our very first visit, after hearing my medical history, he was like, have you ever been tested for MOG? We're going to test you for MOG. And I was like, no, sir, what is MOG? And so you guys need to kind of know what happened after that. I tested positive, and I first started on the CellCept, and now I'm on the IVIG, and I'm also seeing Dr. Flanagan and Dr. Chin. But since this last year of having the correct diagnosis, I mean, I've really felt like it's been so healing to know that there's a whole team of people that know exactly what's going on, or as close to exactly of what's going on as possible, whose job it is to make sure I make it out okay. And also being a part of things like this, being able to talk to other patients and connect. I mean, it's been really everything, getting that diagnosis.
Oh my, thank you so much. I think a lot of people feel the way you do. I appreciate you giving those words of encouragement to others to find same kind of diagnosis. So thank you. I want to go on to Sue, and I think that you really transitioned. Your husband Joe, he had his first onset, and I just want to know, at that point, you kind of, as a caregiver, had to take over. And immediately you're on, it's your responsibility to do whatever it takes to get him the help he needed. How was that for you?
Massive confusion. You're thrown completely off balance. You're not ready for it. Your busy life has suddenly altered and everything's changed. We have done a few things that helped us along the way, and things that I will tell you to do along the way. Have a plan of action. We found this out very quickly. In the first 5 years, Joe had 7 attacks, and we learned very quickly to get things lined up. We don't have kids, but I would urge you, if you have children, to have something ready. Have a place for the kids to go. Have a place for them to go quickly. If there's any special needs, that they are ready to go with those. Pets, if you have a business, your work, all these things have ironed out ahead of time, so when the time happens, because we all know time is of the essence, and you can unload everything there and move on to the hospital where you need to get going. And when we were at the hospital, we also had a plan. Our specialists were very helpful, and we asked them, what do we do? And when you get there, he said, tell the ER doctor that this is what we've told you to do. We tell him, as soon as you can get a neurologist on board, let's do that. We need to get an MRI to confirm the diagnosis, or to confirm the flare-up as soon as possible, and thus to get treatment as soon as possible. They also want to be notified. We have a way to notify our team, and they also want to be notified by the ER. This gets things moving as quickly as possible, and it gets treatment going. It really works. And I can tell you the ER doctor's really happy to hand it off to the neurologist. And the neurologist, who may or may not have heard of MOG, is really happy to have the team on board, because they're going, I've read about it on my way in. So it gets to be a little bit of a chaos. But you don't want to go in and start telling the doctors, hey, I know what you have to do, because they don't like that either. So the other thing we think that's been really helping us a lot is to do some really good record keeping. I have to give my sister credit. The first day that Joe was in the hospital, he was paralyzed from the chest down, and my sister grabbed a spiral notebook and she started writing everything down. She wrote the date, she wrote the doctor's names, the hospitals, the nurses, the tests that were done. We know this, well over 40 tests, right? The outcomes, the treatments, how Joe responded. It was all in there. Every day she did that. We kept it going. After 9.5 years, we're on our 4th book. I can't tell you how many hundreds of times that we have gone back to this book, including yesterday with Dr. Flanagan and Dr. Chen. We were flipping back through these books, coming up with things. In the front of the book, I have just the highlights. The dates that he flared up and the treatment, how long it lasted, his COVID dates, and injections for pain injections, things like that. Anything that's you kind of want to be able to grab right away. These things are so helpful, not only in the appointments, but we have looked back at these things hundreds of times. One thing that it really helped us with, if you have or are going to do disability insurance, those forms are great, aren't they? Yeah. We had everything in this book. They want to know everything. The hospital, the doctors, their phone numbers, their addresses. They want everything. Well, we had it. We just started filling the form out. Then you get to that little area where they say, tell us in chronological order how this went down. You're kidding, in this much space. We're going to tell you about this, right? So I just started spitting out everything that was in my form, everything in my books. Write the form. You get to the end of that, and it goes, attach additional pages if you want. Ha! You mean additional pages I put on there? I put it all on there. I regurgitated the whole booklet. I gave it all to him. I feel sorry for the poor guy that actually had to read all that, or if he did, I don't think he really did. I think he just said, okay, they get it, because Joe got it the first try. I'm not saying that's why. We had excellent doctor notes in there and everything, but the more detail you can give them, they want it. And hopefully that has helped. But I would really urge action plan and record keeping. Really helped us.
Mogmentum 4, one of our resources that will help you do that. Thank you so much. You're amazing, and your husband amazing. I'm so glad that you found the help you need, and I think it's tenacity like that really led to a good result. So I appreciate it. So Michael, I will talk to you next. Michael, you are the head of your family.
Yep.
And this was a very impactful moment that affected you guys deeply.
Mm-hmm.
So I was wondering if you could tell us a little bit about it and tell us a little bit about how that made you feel, what the impact on your life was.
Absolutely. It was obviously very impactful. My wife was pregnant with our 3rd child at the time, just being away from the house and trying to get things figured out. And then when I came home, just not knowing up from down, left from right, and my memory keeps slipping and seems to be getting worse over time. It was a lot to swallow because I had to give up so much just because I wasn't able to do my career anymore. So I got moved to different departments, then to another department, to where eventually the company knew that I was going to end up on long-term disability. And they ended up finding a way to get rid of me. So the biggest impact that I have is, as of lately, has been my memory. It slips. Yeah. So for support-wise, there's the MOG group, which I jumped right in and started talking to everybody online, and obviously the MOG project and the care team Mayo that I have, and also my neurologist back at home has been very helpful for me as well.
I really appreciate that. And has your family had to do a lot to compensate for things that are going on in your life?
Absolutely. I feel sorry for my wife just having to take on so much with 3 kids, and my middle child has autism, so it's definitely difficult, but yeah, they've really stepped up. So,
Well, I certainly got a little bit of time to get to know you guys yesterday, and I can say that first of all, your wife is awesome. I don't know where she's sitting, and your kids are awesome. Oh, she is. Okay, your kids are pretty awesome as well. So, I wish you the best. It's a really hard thing. We're here for you, and we're better people for knowing you and the Lorenzen family. So, thank you for that.
Thank you.
So I guess I will come to Jennifer. You like to be called Jen or Jen?
Jen.
Jen.
Only Jennifer when I'm in trouble.
I understand you're a fellow Yinzer.
I am. I'm from Pittsburgh.
We are both from Pittsburgh, Pennsylvania. And I had no idea. And I met Jennifer yesterday, and I was like, oh, there's one. So I'd like to talk a little bit about what happened to Brody. And, just, as a parent, that must have been pretty hard for you. You were talking to me earlier, and when we discussed this, that it really didn't go as you would have liked. It wasn't as efficient as possible. Do you mind talking a little bit about that and how you overcame it?
Absolutely. So I'll just do a brief. It took about 4 times in the hospital for Brody to be diagnosed. It started in 2020 in November, kind of in the height of COVID. He got sick, which was a cold, that then progressed to headaches and neck pain. We went to the ER, and he was diagnosed with viral meningitis. He came home, and a week later, he was back in with urinary retention. And at that point, it was transverse myelitis. And then we did a steroid taper, and he seemed to respond quite well. High dose steroids and then a taper. And when he tapered down to about 20 milligrams, he had an episode at school where he was disoriented and later had a seizure. And at that point, he did have COVID. So that kind of complicated the treatment. And he was sent home, and about a week later, we were back with urinary retention, vomiting, just different types of symptoms like that. And at that point, they kind of was all hands on deck in infectious disease, rheumatology, neurology, and they sent a sample of his spinal fluid to Mayo Clinic, and he was diagnosed with MOG. But I would say, like, one of the things that we learned, if you have the opportunity and you have the resources near you to go to a children's hospital, that was kind of a game changer for us. We had gone to our local community hospital at first. Then we also went to Indiana University Hospital, which was near our home, and they transferred us to Riley Children's Hospital. It's just a whole different perspective. They can kind of help you as the parents deal with it, and they're so good with children and the right questions. He's had multiple MRIs and spinal taps, and just kind of working through that with a child and trying to explain it to him. That would be one of my big advices in the beginning if you have that. Also agree with Sue, record keeping. Because when you go back into the ER, as long as you have all that, you want to go through the detail of what he's experienced and what you've done so far. And then just some other things like outside of that. He has relapsed 4 times since then. And so we have our stuff ready to go. We work with him quite closely. He knows his symptoms, and he knows when it's time. So we have the bag packed, and we'll talk about some fun stuff we do with that later. And then just some other things is, for those that have school-age children, definitely talk to your school about a 504 plan, because that's really, really helpful to make sure that he has the time to make up anything that he misses or if he needs any special accommodations.
Wow, thank you so much. That's such good advice, and I know that must have been hard. I had a chance to talk to Brody and your husband, and they're wonderful. And I have to shout out for Brody because he's a massive Steeler fan. I think you've done things correctly.
He had no choice.
Talk about being a great mom. Not only did she do a great job with his MOGAD, but she made him a Steeler fan. Thank you. Well, I would say, Carol, I'd like to hear from you. I know that Tim came down with this first attack, and how did that, really drive your role as a caregiver? And could you tell us a little bit about that?
Sure. And I would like to say I wish I had known Sue at that time and what to do, because it would have made life simpler. Tim was woke up on February 4th, 2022, and could not walk. The day before, he had been on a treadmill. We knew this was really wrong, got him to the hospital. Within 30 minutes, I was told Tim had CNS lymphoma or brain cancer. Then the roller coaster began. It took a week or so to rule out a bunch of infectious diseases, etc. Diagnosed with TM, finally put on steroids. He had a few tiny lesions in his brain, but mostly on his spine. He had gotten progressively worse during that week, full inability to walk, the bladder issues, etc. Steroids and physical therapy worked wonders. And we were really focused on that for about 2 months. Tim wanted to get back to work as a financial advisor. We kept moving in that direction, but I was noticing little things but not connecting dots. He was struggling with computer issues at the office, and things just weren't going well. I'm his office manager, and I thought, he's really irritated, things aren't right, and yet he wanted to get his driver's license back. We went into the therapist's office. I was able to sit in. And they asked him, what's your birth date? And he said a date that made no sense at all. Then they had him draw a clock. It did not look like a clock. And it's like, oh my God, what is going on here? And then he started dragging his left foot the next day. Well, by Monday, we were back in the hospital, going through all the tests again. His brain lesions had grown significantly, once again told CNS lymphoma. And again, they weren't really sure. They couldn't find cancer elsewhere in his body and decided that we needed to have a brain biopsy. Tim had a brain biopsy the end of April, and they had challenges with that biopsy. It took several times to get the tissue. They came out afterwards and told me he does not have cancer. He has an extremely rare form of MS. Okay, now we know what we're dealing with. And at that point, Tim was pretty confused, and I knew I was responsible for making decisions, for knowing how we were going to get from point A to B and what we needed to do. And I told him, we have to go to Mayo Clinic. I'm a Mayo baby, grew up here, and I knew that this would be the place to bring him to find out what's really going on. We talked to, we were getting ready to discharge him locally, and a neurologist never came to see him, and they weren't giving him steroids. And the one thing I knew from the TM attack, he needed steroids to reduce that population of lesions that was going on in his brain. The nurse, I told him I would not discharge and take him home until we got the steroids. So they took me out to the nurse's desk and they called the neurologist. He finally gave in and sent us home with steroids. I called his local neurologist. She said, you did the right thing. We don't want those lesions to get any larger. And then I asked her if he could get a referral to Mayo Clinic, and her eyes lit up. And she said, absolutely, I'm a Mayo grad. So we were really excited to at least know that we could come and maybe get some help with this MS, because our medical plan did not have an MS specialist in the Twin Cities. So as we were waiting to get through the hoops with Mayo, and I went through all the channels, we got a phone call from his local neurologist and said, I need to talk to the two of you. And I thought, okay, she's going to talk to us. She was working on our insurance plan because the treatments were very expensive, wanted to make sure we would know what this was all about. And she said, I have to tell you, we don't think it's MS. We think it's brain cancer. I could not believe that we were going through this again. So then Mayo does have a way to get in if you think you have brain cancer very quickly. But when I called about that, they said, oh, you're already going to see a neurologist. We've got Tim all lined up. So we got to Mayo. The neurologist said, you do not have MS, but we have to rule out all these other things. So he went through all the testing again, but one additional test was a PET scan. And then he also was not presenting and never has had optic neuritis. So it hadn't connected some dots along the way. And as we were going through all of this, he also had some cognitive testing. They thought he was colorblind because he couldn't denote the numbers in the dots, if you've all seen that, but he couldn't denote them because his brain wasn't working, not because he's colorblind. So things were kind of blurry, trying to figure out what this all was. And we met with Dr. Chen, which was the first doctor that he said, I got some good news. Tim doesn't have cancer in his eyes. And that was fabulous. And he named off about 3 diseases, none of which I could repeat today, but one was MOG. And it was like, are there treatments for this? And he said, absolutely yes. And I could feel my blood pressure going down. I could feel Tim's blood pressure going down. Tim does not handle steroids well, and his blood pressure had been pretty high. And so we went through the testing, and as you heard earlier today about all the studies that people do, Tim's always one to say yes, take my blood, take my lumbar puncture fluids. On the date that we were 4 weeks into this at Mayo, we got a phone call from the fellow who said, we don't have a diagnosis yet. Oh, no. Because I was like, if he has cancer somewhere, we should be treating it. And I kept voicing this because I felt like we had already lost 5 months. And I was afraid Tim wasn't going to make it to his 60th birthday. They spent some time together, and I understand went to Dr. Flanagan, who gave approval to look at this fluid Tim had given for research, and there indeed they found the MOG. And this was on a Friday, by Wednesday of the next week, we met Dr. Flanagan, and the rest, shall we say, is history. Tim is part of a trial and is doing fantastic. But if we had not pushed for all that testing and the steroids, and along the way, I hate to think of the condition that Tim would be in today, because Tim's brain lesions have not fully dissipated, and he does have cognitive impairment.
Wow. I think I hear a lot of stories all the time. I talk to a lot of people. And, one thing that stands out is that desperation that you had. The biggest fear that I have is that, people who come in with and have this brain issue, how do they advocate for themselves? If they don't have a caregiver, and also if they do have cognitive abilities, how does somebody explain to them what's going on, and maybe the intricate care that has to happen with this disease, also predicting a relapse or even looking for signs of a relapse and managing their own disease. So this is where, it's very obvious. We've got one of the best caregiver groups on our executive board, the Mitchells, and we have Andrea Mitchell and James sitting right here, and James is a caregiver for Andrea, who is blind. And I'll tell you, if you don't have a caregiver, that is just it's almost impossible in some cases to manage your disease. So thank you so much. The role of the caregiver is definitely a huge one. So I don't want to say last but not least, but we've got Derek here, and he's another caregiver. His wife Jennifer, who is out here somewhere, she's actually going to be. Jennifer, raise your arm. I can't see it. There you go. She's joining our actually MOG Project Advisory Council. She's going to be a great addition. She's been a lot of help. But Derek, I would imagine that Jennifer's story, and you could tell us a little bit about it, was one of the most horrific stories that I've heard, and she had a lot of extra things that happened that were very difficult. And I think you and your family really had a hard time. And I'd like to hear from you about how that impacted you, what it was like, and just basically what you would say to others based on your experience, something that could help them.
Yeah, great question. I joke with Jennifer a lot, like, congratulations for finding the most rare disorder that you could possibly find, And on top of that, one that nobody can pronounce. I remember being at work, like, what's wrong with your wife? Like, she's got an MS thing, and just kind of let it go. Like, even the acronym, I was calling it MOGAD forever. Evidently, it's MOGAD. I just shortened it to Mo for, like, Mo problems. Like, we just got problems going on. So But our experience, and I want to be sensitive to the audience here and the panel, because everybody's experience is different. Sometimes I catch myself wanting to say, I'm so thankful it happened this way, but then there's somebody in the audience that it didn't happen that way for you, right? Like you didn't get a diagnosis in the past, 5 years. It was 20 years ago, and they didn't know what in the world that you had, and they mistreated you, and you have some long-term issues because of that. So, with sensitivity to all of that, I want to kind of tell you a little bit about our story. I'll probably get it wrong. My wife's in the back. She's I call her my corrector-in-chief, so she can tell you the real story. But, when something like this hits your life, you're in the middle of life. And one of the things I was thankful for is that we didn't have small children in diapers, and we were having to try to juggle that plus this. My youngest was in high school. My oldest was in college. So Jennifer presented with a headache and eye pain initially. We had just bought a home and remodeled it, did a lot of the work ourselves, a lot of dust flying around and paint, and it was a 100-year-old house. Like, there's no telling what we breathed in, trying to get this house up and livable. So I thought she had maybe a sinus infection or something like that going on, but the pain persists, the headache persists. That ran into some severe eye pain. She wasn't responding to pain medications. She didn't have a history of migraines, although we hit her with some migraine medication and just nothing helped. And we had a really good friend at the time that said, we probably need to take her somewhere. So we took her to the eye doctor. The eye doctor says, man, I don't like what I see. So they bumped her over to the neurologist, and she's like, I don't like what I see. And they put her in the hospital pretty quick. So I was thankful that the progression was really fast from when we kind of figured out we need to take her somewhere to them getting her into the hospital. And we're in the middle of nowhere, Oklahoma, and our neurologist is like, put her on steroids really fast. So that gave her some almost immediate relief. And then ran some scans on her, and she's like, yeah, you got one of three things. Only one of them had we ever heard of, which was MS, and there's NMO, and then there's MOGAD, Mo problems, So immediately we were like, okay, MS, that's not good, and which one of these other two might be a possibility. So they drew blood, sent that off, and it came back that it was MOGAD. So then there was, just trying to figure out treatment options and those kind of things. But to your question, I think for Jennifer, the worst part for me, and it's the worst part at different times of your progression through, understanding what she's got and then what treatment needs to happen. So initially for us, it was just fear. And I think that's probably everyone's initial issue, like what's going on, what's the long term. Immediately, it's kind of like a car accident. Your mind starts racing, and okay, what am I going to do? Do I need to quit my job? How are we going to get support to get her to things she needs to get to? Get her so anyway, there was just a lot of things going on. So that was the initial issue for us, was just the fear. And then, on the heels of that, for me, it was just anger. Like, this is not supposed to happen to us. These things happen to other people. And we were, Jennifer was perfectly healthy otherwise. So we hadn't had any, lead-up issues or problems. She just got hit with this pretty quickly. So it impacted our lives logistically pretty quick, because we had to have a team of friends and family, because I had to keep working, that would just help us. We had recently moved to Oklahoma from Texas, and she was seeing her folks at UT Southwestern and UC Southwest in Dallas. And so just trying to coordinate getting her there was, a headache in and of itself. And so for, what I might want you to know if you're new to a diagnosis is that, gosh, look around you, look at the room, look at the support, look at the people that are around. So get everybody's numbers that you can get, because you've got a lot of support here. So that's what I would say is you're even though this is a rare disease now, as this becomes, as folks become more aware of this, in the medical community does, I think there's more folks out there that have this than are presenting now. So you've got a good community now, but that's just going to grow. So I think that would be my advice, is to get connected with the people in this room, certainly the professionals in this room, the folks at the Mayo Clinic, I think can really change your life. So.
Thank you so much. I know it must have been really hard for you, and you guys are a strong family. It was absolutely wonderful to meet all of you yesterday. I have to say, I am going to now steal the Mo problems. I have to. That's a good one. So
Trademarks.
yeah, it is. Okay, I'll keep that in mind. It's great hearing from you all. I just, before we close, I just want to go all along the row here. And if you could just give me one word for you that describes, just one word to tell everybody, if somebody said MOGAD to you, or MOGAD, whichever you want to say, what would you say back? And try to keep it clean.
Okay, that's two things now. One word and keep it clean. Come on.
Yeah.
Complicated.
Mysterious.
So I can't do it in one word, but I'll do two. Just hold on.
That's really hard. I would say unknown. There's just because there's so much unknown of what the future is for, especially somebody young like Brody. So I know that's more than one word, but that's fine.
I think I would say resilience.
Get two microphones. That's great. I would say I would say hope and patience.
All right, let's give a big hand. I want to point out that every one of these people have just donated their time in a lovely manner to help put this together. And just being up here is huge for us. So thank you, everybody.